Right, so we've got three symptoms here. Proctitis, silodinitis, and irritation.
Those don't sound like they're related to a single condition.
I concur. The symptoms seem too diverse.
They do indeed, Dr. Hawks.
Well, I think it's cherubism. Just ignore your theories for once.
Fine, but we're all going to be in big trouble if you're wrong again.
You need to stop this impulsive decision-making and consider other possibilities, Dr. Hawks.
We don't want to risk the patient's life with such a risky treatment as liposuction.
I'm not asking for your opinions. We're doing liposuction. End of story.
Fat chance that'll go wrong.
Shut up!
Look, Tracy, I've been doing this for years and my instincts tell me that this patient has cherubism.
Hawks, you have a history of being wrong when it comes to these diagnoses?
Well, let's just say I'm right for once. You should trust me on this one.
I wish I could, Hawks, but your track record speaks volumes.
You need to move forward from the past and embrace my expertise in this matter.
Is that what you're calling it? Expertise?
Yes, Tracy. That's exactly what I'm referring to. Stop questioning me and start believing in my abilities.
I'd love nothing more than to put faith in your decisions, Hawks. But I think we've both learned the hard way that you should probably consult a second opinion before making any drastic changes.
It's clear we made a mistake by performing liposuction on this patient, Frank.
I concur, Dr. Randall. We must address our errors and devise an appropriate treatment plan for cherubism.
Absolutely. The first thing we need to consider is what caused this reaction in the first place.
Perhaps we can explore genetic therapy as a possible solution.
Genetic therapy could be effective. However, it's crucial that we study and understand the patient's medical history before jumping into any conclusions.
Of course, Dr. Randall. It's also imperative to mention our sincere apologies for this unforeseen consequence.
I second your sentiment, Frank. We'll make sure not to repeat these mistakes moving forward.
How about after we figure out what's wrong with the patient, we go to the Chinese buffet down the street?
We're done talking to each other for the rest of the day, Frank. That's enough now. Shut up.
You dumb fucks nearly killed that patient with your shit liposuction and cherubism misdiagnosis. What's wrong with you guys? You can't even do a goddamn surgery, right?
But Hawks, we thought.
Shut up. You have no idea what you're doing. I'm gonna get someone competent in here to fix your mistakes.
Wait, Hawks. What do you think the diagnosis actually is?
And how should we treat it?
We didn't mean.
It was a liposuction. How do you mess that up?
Give a bucket with water in it and instructions on the bottom to Frank. He'll mess that up.
Randall, your parents messed up approximately 40 years ago. So did all the orphanages who turned down their offer to give you up for adoption.
Damn, that's rather personal coming from you, Hawks. Are you on drugs again?
What makes you say that? The fact I seem more tolerant to your bullshit than usual. Everybody fuck off. I'm getting food. You know, I've been thinking a lot about my patient, Johnson.
What about him? He's making good progress, isn't he?
Yes, that's true. But it's the way he's improving that's got me puzzled.
Oh, you mean his rapid recovery? I was a bit surprised by that too, but it seems like he's responding well to treatment.
Rapid recovery.
Well, whatever the reason, you're doing good work here, Hawks, and the patient is lucky to have someone as dedicated as you looking after him. Speaking of which, how's your sister, by the way?
Oh, she's doing great. Has 3 kids, a husband, a really horny zebra in the backyard that makes love to their petunias as the sun sets.
That's more detail than I was expecting.
She's fake, Johnson. I don't have a sister. I don't know if you were trying to expand lore that we were never revisiting or what.
I was just testing to make sure you were still the real Hawks. I heard the outburst in your office earlier.
All that. It was just rehearsal for a play called You're a Bunch of Lazy, Useless Cunts. Hooray for Demonetization.
Would anyone watch a play with a catchy title like that?
Not unless we're getting paid, which, by the name alone, suggests we're not. Oh shit, I have a patient to look at, gotta go. Alright. I know we're all worried about my safety, but you have to understand that I just saw something that could save a life.
We care about your safety too, Hawks. We don't want to see you hurt,
You wanted me to die earlier, Leslie.
preferably in no pain so we could still have functioning eardrums.
You can't just storm into an operating room without the proper gear. It's dangerous.
And what if you're wrong? This new diagnosis of yours could have serious consequences for these patients.
I understand your concerns, but I'm telling you, this isn't cherubism. It's extraskeletal Ewing sarcoma. Yes, I know. I just got the news during lunch with Dr. Johnson. But I assure you, it's accurate.
Was that lunch you had with Dr. Johnson or a ton of beer? That belt of yours doesn't give us any assurance you know what you're talking about.
I agree with Leslie. The patient's safety is paramount, and we have a process for this kind of thing.
So are we going to continue with the current procedure, or will you get some proper gear so we can discuss your new diagnosis? I know you've had lunch, but there's more work to do than just solving medical mysteries over dinner, Hawks.
Do you guys even want to know the prognosis?
Sure, lay it on us, Hawks.
That's the fun part. I'll let you solve for X.
Well, I think we're all glad that you found the correct diagnosis for your patient. You should be proud.
Thanks for the pat on the back. But you know, this ordeal wouldn't have happened if I had less idiotic doctors to work with. The whole team needs a good goddamn kick in the butt.
Wait a minute, Hawks. You were the one who made the incorrect diagnosis here. And then you have the audacity to shift the blame onto your own diagnostics team. That's just not right.
What are you talking about?
I said it was extraskeletal Ewing sarcoma, and that's what it is, isn't it?
You're a doctor. You know how crucial correct diagnoses are in healthcare. But instead of taking responsibility for your mistake, you're trying to put the blame on others.
I'm giving credit where credit's due. If I wasn't so generous, you'd only be nominated for biggest pain in my ass all day. But you won. Take your prize and go home to do God knows what with it.